Thank you for joining us. Appreciate the opportunity to be here. And a couple of people I want to introduce. First of all, thank you. There are a number of people from organizations here that are really the heroes in this fight against opioid addiction and what we are up against in our city, in our state, in our country. I'm so appreciative, particularly of Heidi Riggs, who is in the back. Heidi's back there, I think. And what Heidi has done is, when people lose a child or lose a loved one, there are lots of different ways to grieve. And what Heidi has done is, rather than, to just turn that grief inward, she has tried to change people's lives and try to make sure that other parents don't have to go through what she did. So those are the real heroes in our society that really make a difference. It's not elected officials. It's not even LeBron James who are the heroes. It's really people like Heidi. LeBron James, you know who he is in Columbus, right? You all know this? Come on, wake up. Come on, really? Okay, all right. Joel, help me here, man. Come on. Joel. Anyway, special thanks to the guy they named this fire station after, too. Mitchell, thank you for being here. And especially Michelle Wolf, who will speak to us in a moment about her struggles. We have two other people with us today, Sierra and Nicole, who have both struggled and are both getting their lives back together and their families together, and going back to school and doing what they need to do as they fought their addictions. And these stories are too common. They hit too many people of all races and all backgrounds and all occupations and all stations in life. So thanks for your courage and your Sierra and Nicole, your willingness to stand up and be here when many would not be willing to do that. So your being here and speaking out really helps us, as obviously that Michelle being here and speaking out is so very important too. Also joined by Zach Klein, longtime friend, city council president's doing a remarkably good job as this city sort of has had a transformation. In many ways, there's such a success story in Franklin County and the city of Columbus, and moving its economy and state and city government forward. And Zach, as the relatively new council president, is doing remarkably good work. And Dr. Teresa Long, who is on the forefront of every important public health initiative that our office works on, that Columbus has embarked on. She and Zach have teamed up in combating one of the worst scourges of our society, not opioids in this case, but low birth weight babies and infant mortality. In our state, shamefully, is about at the bottom of the 50 states in infant mortality. And what Dr. Long has done and what Zach has done on city council and beyond is so very, very important on that. We know this. We're going to talk about naloxone today. We know what has happened in this community from January through July of this year. Columbus Fire and Police used naloxone to save the lives of more than 1,100 Ohioans suffered from overdoses. In July, it was 200 alone in July. I mean, you think of the significance of that. 1,100 families spared the agony of burying a loved one, and 1,100 people who now have chance of recovery. Of recovery and a better life. It should not be easier for Ohioans to get their hand on opioids than it is for first responders to have access to these life-saving drugs. It shouldn't be easier for Ohioans to get opioids than it is for first responders to get these life-saving drugs. Addiction isn't just an individual problem. It's certainly not a character problem. It's a chronic disease that, when left untreated, places a massive burden on families, on individuals, on their families. Addiction is almost always a family problem, ultimately, as your families know, and puts such a burden on our healthcare system. The good news, to a point last month, the president signed the Comprehensive Addiction and Recovery Act, the CARA, into law, which is a good first step, but it doesn't go nearly far enough. First responders need funding to maintain a supply of critical drugs like naloxone. They need training to use those medications effectively, and we've seen what a lack of funding has done in this community and around the state. I was talking to Chief Martin a few minutes ago, about what the cuts in state government to the local government fund and to the state tax is meant to communities like Cleveland and Columbus and smaller cities like Newark, what it's meant in terms of providing services. The federal government and state government have absolutely failed when it comes to providing the dollars for these treatment programs and for prevention and education. We know how to cure people that have addiction. We simply don't have the resources. No community in the state has the resources because of the failure of state government and the federal government. They'd rather give tax cuts to millionaires and billionaires than to invest and fund and recovery programs, whether it's the West Side, Pastor Nancy, or whether it's the East Side, or whether it's anywhere else in this city or in this state. As I say again, it shouldn't be easier for Ohioans to get their hands on opioids than first responders to get naloxone. The city, the state government, the federal government need to step up, provide the dollars so that we can save people's lives and then begin to help them on the road to recover. We can't do that if we don't have the local dollars to do it. My pledge is to continue to work with Congress and with state government to do that. My pleasure to bring forward Council President Klein. Thank you. Thank you, Senator.
Well, thank you, Senator Brown, and I appreciate his kind compliments. He is a true champion. We're very fortunate in the state of Ohio to have our senior Senator Sherrod Brown leading the charge on so many causes like the heroin epidemic and taking on the many tasks that are necessary to improve people's lives here in the city of Columbus and across the state. So thank you for being a friend of Columbus, and thank you for all the great things you do. And we're just grateful that we have Senator Sherrod Brown in the United States Senate leading Ohio's causes. This is a big deal. There's a lot at stake here that touches upon people's lives. That this is not something you simply see on TV or think that doesn't happen to you because of where you live or where you grew up. This is a problem that we have not only in the city of Columbus but across the state of Ohio that sees no race, sees no class, sees no income restrictions. This is a problem that can affect your neighbor, can affect your daughter or son. And look, I have a 2-year-old and a 4-year-old. It's something I think about every day, how pervasive this problem is. It can affect the person you're sitting next to in church. And so I'm glad that Senator Brown's here as someone who's leading the charge on the Comprehensive Addiction and Recovery Act to get funding, because Washington, we have a problem. We have to do better to provide the funding that's necessary to get Narcan in the hands of first responders. CARA is something that is necessary not only for our first responders, and thank you for all the great things that our men and women in fire do, but for law enforcement, for prosecutors, for corrections officers, for medical professionals. This is a bill that saves lives by providing Narcan. It improves lives by providing medication-assisted treatment, and it makes our lives safer by expanding diversion programs for law enforcement personnel. It's a necessary first step, but without funding, it's just that. It's a first step. To me, what Washington did and what the United States Senate did in approving CARA was a Washington headline. We need a real-world headline of having funding come into our communities. We're fortunate enough in the city of Columbus to be able to have Narcan that's provided by our police and fire personnel. But not every community is fortunate as ours. So what are we doing to make a difference for them? And together we need to rally to make that difference. Because this is a pragmatic and realistic step in the right direction of providing funding to make an improvement in people's lives. This isn't a social service program. And it may sound like people have asked me questions like, well, aren't you just feeding addicts? If you look at addiction as a disease, which it is, and not from the lens of law enforcement, which we've done for the past 40 years, we can make a difference in improving health outcomes in people's lives, which could be your family member or relative, but it also saves us money and makes our community safer. Because if you're addicted to drugs and you need money to buy drugs, what are you going to do? You're going to break into cars, you're going to burglarize houses in order to get the money necessary to buy heroin. That's why this is not social service. This is effective law enforcement, and I truly believe that if we can get funding for CARA, that we can make a difference in making our community safer. And I got to close just with this one story because it touches me every time that I hear it about how this is just how important this is. And that's when our EMS responders responded to a house where a mother was breastfeeding a child that was 34 days old, and the baby OD'd because the mom was doing drugs. Are we in this to save the babies? Are we in this to save children? We can rally as a community to make a difference here, and we can stand together to improve people's lives. And in Columbus, we're going to take the step with Sherrod Brown to make sure that happens. So thank you for being here. And thank you to all the survivors, Michelle, Sierra, Nicole, for sharing your story, and for Heidi Riggs, there's Heidi, for telling your story and doing what's necessary. Because this affects everyone. This affects everyone, whether directly or indirectly, and together we can make a difference. So I'd like to bring up at this point my partner in all this, Dr. Teresa Long with the Department of Health. Thank you.
Well, good morning, and thank you. Thank you, Senator Brown, for joining us this morning on an important morning. Thank you, Council President Klein, Michelle, Ms. Wolf, I'll introduce in just a moment. Thank you for being here. And actually, again, thank you to our council member and safety chair lead, Mitch Brown. Actually, we are in the House of Brown, and we've got two Browns here, so yikes, it's, I guess, a good morning. I know it's a good morning. Thanks again to obviously our sobering but very effective colleagues in our fire department, Assistant and Acting Chief Cannell, Chief Jim Davis, and Battalion Chief Martin. So again, thank you all for hosting us. We are in the midst of an unprecedented epidemic of drug addiction. And yes, overdose related to that. Overdose caused by prescription pain medications and heroin. And yes, it is a public health crisis. As your health commissioner and a physician, let me clearly state that heroin addiction is a chronic, relapsing brain condition. This is, again, a chronic, relapsing brain disease that can cause devastation, yes, to individuals and families, but devastation to communities that are already vulnerable. Addiction is not a disease of one's character, but of one's brain. Heroin and opiate use has gone up in Columbus, as you've heard, up over the last 5 years, and these drugs are responsible now for more than 70% of overdose deaths in Franklin County. Nearly every day, we lose a loved one, a father, a sister, a nephew, a daughter or son doesn't come home, shattering dreams and lives forever. Needle injection, the prime method of heroin use, also drives the spread of HIV and hepatitis C infections. Consider that hepatitis C cases have increased again 70% from approximately 950 cases in 2012, so in just 3 years, to over 1,600 cases in Franklin County in 2015. Again, a 70% increase in a short period of time. Likewise, in 2015, the Columbus Division of Fire administered naloxone, commonly known as Narcan, over 2,200 times. In the first 6 months of this year alone, our partners right here from fire and police have saved nearly 1,200 lives by administering naloxone. I see some nods in the audience. And yes, the predictions are that we will actually go over that number from last year, which again, topped the charts. And just 1 month ago, we had more than 40 overdoses in one weekend and 2 deaths. Mansfield had just had 8 deaths, 8 overdoses in 30 minutes, in 14 overdoses in 8 hours. We've also seen these stories in Akron and Marion and Dayton, just a short drive away. Every time I hear it, I think, that could be us. And it will be us. It will be us again. This is just a matter of time. So again, we must be ready. And actually, Battalion Chief, or Chief Davis, we check in very frequently. And actually, we had a bad weekend in Columbus this past weekend with 31 saves and 31 overdoses that our Columbus Fire responded to. So again, it is a matter of time till we have the really bad weekend. But every weekend and every day is a day that, again, we can be taking action. Some may look at naloxone as enabling. We do not. This is an intervention that is life-saving. It is life-saving during an episode that is due to a chronic relapsing brain disease. During my training in the emergency room, we would never, ever have questioned an intervention to save a life of a heart attack patient. A drug overdose is no different than providing CPR to a cardiac arrest patient or administering insulin to a diabetic. Like cardiovascular disease or diabetes, again, addiction to prescription pain medication or heroin is a chronic disease that is difficult to cure, but can be effectively treated. We need to fight the epidemic as we would any other disease outbreak with a multifaceted public health approach to help people who are already addicted to get treatment and to prevent people from becoming addicted in the first place. Punishment, stigmatization, shame are not a cure for any disease. When we have a crisis like this one, we must have the resources we need. Naloxone, emergency response, treatment, and support for recovery have to be and must be a part of our collective efforts. I urge our federal partners to act immediately to make naloxone available to our first responders. Naloxone gives us a chance to help our residents and our neighbors and our family recover. Honestly, you can't recover if you're dead. Naloxone gives people a chance at life, a chance at recovery. Again, there are no quick and easy fixes, but we must work together on a solution that helps people who are addicted while preventing others from becoming addicted. We must do both. So again, I urge our federal partners to be a part of the solution by fully funding this comprehensive plan for Central Ohio and for communities all across our country that are grappling with this public health crisis. The health and safety of our families and our entire community are counting on you, on me, and all of us. We must not let them down. So thank you, but before we close, I would like to invite my new friend, but invite Michelle Wolf to share some of her story and her experience. Michelle?
Thank you.
Thanks for joining us.
Yeah, thank you. Hi, thank you so much for having me, and thanks to Senator Brown, Dr. Long, and Zach for all that you're doing for our community and for helping break the barriers of addiction. Diseases like heart disease, cancer, diabetes, they don't discriminate. And the disease of addiction is no different. It definitely does not discriminate. I grew up, had a great childhood, grew up here in Gahanna in Columbus, had loving parents. I excelled in school and sports. I was what you would call an overachiever, and I went on to play college basketball at Cleveland State University and then Ohio Wesleyan University, and had a great athletic career and went on to be the assistant women's basketball coach at Northern Kentucky University and helped lead the team to a national championship, and I earned my MBA. And I had no idea about addiction. I have a few family members that have suffered, but other than that, I didn't know much about it. After my 5th shoulder surgery, it was like a light switch had gone on. I was addicted. From that moment on, I was a prisoner of my addiction. I was always seeking painkillers. You know, my disease was progressing. I couldn't get enough. This went on for 7 or 8 years. I continued to work. I was in sales. I continued to thrive in my job and in my family life, but my disease had a grip on me. It had a grip on my brain. It had a grip on my heart. I was slowly becoming a different person. What I like to say is my brain had been hijacked. I was starting to do things that went against all of my morals and values. I was starting to lie, manipulate, cheat, steal. I was a con artist. And I was doing things that I never would have thought I would do in my wildest dreams. And one day, I was trying to get painkillers, and my dealer had run out, and he had heroin. And I tried heroin on that day for the first time. And from that moment on, I was addicted to heroin. In a little over a year, heroin took me to places that I don't wish upon anybody. It took me to the darkest place of isolation. I pushed the people that love me and care about me as far away as possible. And the biggest thing for me is, I have a disease that lies to me. So my brain tells me that I can try heroin once and be okay, or I can steal and not get caught, or I'm not a bad person. And because my brain has been hijacked, I'm going to believe everything that my brain is telling me. And what I'm doing now is, because of family and friends and the intervening of Heidi Riggs, they came in and they helped save my life. They got me to treatment. At the very end of my rope, I was completely isolated. I had no one. I looked like what you would call a junkie. But behind every addict, there's a person, there's a story, there's hope. And, thank God for my parents, my partner, and Heidi. I got to treatment, and I learned about the disease of addiction. I learned how to treat my disease. And I've been sober today for 14 months. And I'm doing things today in sobriety that I never thought I would ever be able to do in my life. I get to work for a treatment center. I get to help get people to treatment. I am on the board of a nonprofit, Marin's Hope. I get to open up sober living for women and find a place for addicts to live, a safe place for addicts to live. And, the biggest thing for me is that I want to help break down that stigma of addiction. It can happen to anybody. I am the face of heroin. And like Zach said, it could be your daughter, your sister, someone you're sitting next to. This is a chronic progressive disease. And Narcan is so important. Not only can it save a life, but it can help plant that seed for somebody that's at the end of their rope. That might be their bottom. That might be what they need to save their life, to get to treatment, to learn how to treat their disease. And, Dr. Long, I loved the analogy that she used with diabetes and heart disease. We wouldn't think twice about giving a diabetic insulin or someone having a heart attack epinephrine. The same should be done with Narcan, and it should be done with compassion. Because like I said, that person that overdosed is someone that has a story, someone like me. And today my life is full of so much hope and joy and love and laughter. I get to be a daughter, I get to be a partner. I'm a mother of 3 boys, and I'm loving life today because of sobriety and recovery, and because of people in the community that are, using the tools like Narcan to help save a life. So thank you so much for having me. Thank you for caring. And remember, behind every addict is a story, and there's hope. So thank you.
Thank you all for coming. Thank you for that story. Thank you very much for sharing.